heat of summer upon us, more skin will be exposed to the sun, and now is the time to be thinking about skin protection and prevention of melanoma. This segment is sponsored by TPMG, Hampton Roads Center for Dermatology. Dr. Valerie Harvey is a board-certified dermatologist, and she joins us with more on what to look for when it comes to skin cancer. Dr. Harvey, welcome to the Hampton Roads Show.
Thank you. Good morning. So good to be here.
Dr. Harvey, please explain melanoma.
Sure, I'd be happy to. So melanoma is a type of skin cancer that can occur anywhere on the body. It tends to happen on sun-exposed areas and can look like a mole that's changing. We always tell our patients the ABCDs of melanoma. A stands for asymmetry. B stands for borders that look unusual. The color is usually different. It may be darker, it can be black or red or blue, but it may have variations of the different colors in the same mole, and it tends to be bigger than your other moles. So those are just a quick way to remember some of the signs to look for when you're concerned about the potential of having a melanoma.
Let's talk more about Skin Cancer Awareness Month. It is underway, and what should people be doing?
So skin cancer is actually the most common cancer. More than 3 million Americans each year are diagnosed with skin cancer. As I said before, as with melanoma, they tend to happen in sun-exposed areas, and sun exposure is the biggest risk factor that we have for development of skin cancer. It tends to happen in older individuals on sun-exposed areas. If you develop a growth that just won't heal, won't go away, that looks different than the other areas, then you really need to see a dermatologist who can examine you and evaluate you to make sure that you're not suffering from a skin cancer.
Starts with self-examination and then go see the professional.
Absolutely. Exactly. Start with self-examination, and then if you see something that looks different than the rest, I call it the ugly duckling sign. If it looks different than the rest of anything else that you have, kind of persistent, not going away, time to see a board-certified dermatologist.
Great advice. What about
Yes.
skin cancer in people of color? Some may think darker pigment prevents burns, and therefore skin cancer isn't something to worry about. Is that true?
So that is a big myth, Chris. Skin cancer can happen actually in anyone, regardless of skin color. Even though it's more common in non-Hispanic whites, we do see patients with darker skin color getting it. And in fact, when they do develop skin cancer, it tends to be diagnosed at a later stage, and it tends to have a greater risk of mortality. So, nobody's completely immune to it. Again, if you see something that you're concerned about that's new and just not going away, irregardless of your skin type, you need to see a board-certified dermatologist.
And before we let you go, how often should we be checking ourselves and be checked for skin cancer?
Yep, so that's a really good question. I always advise my patients to do monthly skin exams. It really varies on how often someone should see a dermatologist. It really depends on how many risk factors you have. But in terms of doing self-examinations, once a month is a good rule of thumb.
All right, great advice. Dr. Harvey, thank
Yes.
you so much for joining us today on the Hampton Roads Show.
Thank you so much for having me.
This segment of the Hampton Roads Show is sponsored by TPMG Hampton Roads Center for Dermatology. New to Virginia Beach, located at 4421 Virginia Beach Boulevard, Suite 106A. The phone number is 757-232-8856. Also in Newport News, located at 860 Omni Boulevard, Suite 114. The phone number there, 757-568-5423. You can also visit mytpmg.com and connect on Facebook at Tidewater Physicians.